Your lips are our obsession. We want to give you something that you absolutely love. We have every type of patient who walks in the door who wants something from simple, subtle, don't want anyone to know that they've had anything done, just look a little more hydrated, to wanting to change the shape of their lip and change the different ratios of upper to lower. There's all kinds of different ways that we can address your lip goals. So we use a variety of different techniques and product types to deliver these different results. So if someone wants a more bouncy, full lip with a lot of structure and definition, we use certain products like Ultra or even Define to really give that contoured look to the lip that looks nice and full and plump. If a patient wants something that's a little more subtle, looks more like internal lip gloss, just makes the lip look a little bit more hydrated and plump, then we use a product like Volbella. It's very soft, it's very natural looking, and we also can change our volume. So someone who wants a more plump, full lip or wants to change the ratio or shape of their lip, we may do 2, 3, maybe even 4 sessions to really get you to that perfect look. It may or may not be a full syringe each time. It really depends on what you're looking for. For someone who wants something more subtle, maybe we can get you the results that you're looking for in 1 or 2 treatments. So in some, we can change our technique, we can change the product, and we can change the volume in order to deliver the results that you're really looking for lips. A lot of patients are concerned that their lips are going to look lumpy, bumpy, or be too big. I think that they've seen this on their friends or maybe people walking around, and they just see that the lips look unnatural and too big for their face. The way that we avoid this is we make sure to not just inject only the lips. If other areas of the face need to be addressed in order for the face to look balanced with the lips that you want, it's important that we tell you and that we do address those other areas of the face. The second biggest concern that we hear is pain, and I totally understand that. We make sure to give you 30 minutes of our strongest numbing cream topically. We always use gentle hands and take our time. And I always make sure to use the smallest needles possible to deliver the results. So the third concern that we hear is, what happens if I don't like it? So I want you to know that we only use dissolvable filler in this practice for lips. So what that means is if you don't like the way that it looks, I can dissolve it. We can erase that with Hylenex. Hylenex is hyaluronidase. It is an enzyme that we can inject to break down the filler. We also use Hylenex if someone has been what we call migrated, which means that the filler has started to migrate over time, either into the mouth in the mucosa or above the mouth into the skin. Either way, we are trained to recognize this migration and tell you that we need to go ahead and erase that before we go in and inject the filler again. If I put filler on top of migration, I'm only going to make the migration look worse, and we're gonna have to go in and dissolve it all anyway. To maintain your beautiful results, please return to the office every 6 to 12 months.